Hi, I'm Dr. Bhalja. I'm the podiatrist here at Downtown Physicians on 80 Maiden Lane. And today we're going to talk about hammertoes. So what is a hammertoe? And I'm going to show you on this foot model. Basically, it's a contracture at the toe, which occurs at two different joints. So it can basically occur when there's instability at the metatarsophalangeal joint, which is right here, and then a contracture at the end of the toe right here, and you'll end up with irritation kind of at the top of the toe or the tip of the toe in shoe gear, or even when you're walking barefoot. So this can be caused by three different etiologies. So one is that there's weakness of the intrinsic muscles in the foot, which are the small muscles in between the toes. Basically, it can occur in a flat foot type, which is when the foot kind of collapses at the arch area and causes you to move and walk towards the inside of the foot. When that happens, those intrinsic muscles, they try to oppose that force. And over time, they can get tired, fatigued, you can get some cramping and pain, and it can actually cause that contracture to occur at the toe. The second reason it can occur is due to flexor stabilization. Now, what that means is that the same kind of foot type, the flat foot type, in order to oppose that, there are long tendons on the bottom of the foot, and they start contracting to pull the foot up when it needs to during the gait cycle. This can also cause instability at that metatarsophalangeal joint that I spoke to you about before, and cause that appearance of the toe to be contracted as well. The third type is called extensor substitution. Now what that means is that typically occurs in actually a high arched foot. And that means that the extensor tendons on the top of the foot pull way too hard during the gait cycle and stay that way throughout the gait cycle. That means that you probably have a hammertoe on and off weight bearing. So it's typically a little bit easier to define during a clinical exam. So these are the three main things that can cause hammertoes. Now, how do we go about fixing that? So there are a few options that we have on the conservative side. So first, we can start with changing or modifying your shoe gear to make sure that you're wearing the right size shoe and the right type of shoe that's gonna help to accommodate that deformity. The second thing is we can probably send you to physical therapy, and that way they can work on rebalancing the musculature and strengthening the muscles that need to be strengthened and stretching the muscles like in the calf that need to be stretched in order for you to walk better and without that deformity. The third thing we can do is some accommodating. So padding and strapping can actually help to reduce irritation on the top of the toe or the bottom of the toe. We can also get you custom orthotics, and that way we can have a better functioning foot in and during the gait cycle to help with the straining of the muscles that occurs during this deformity. And the last thing would be surgical intervention. So we always kind of keep that as a last resort after the conservative measures don't work. But for that, we would need radiographic imaging and a clinical exam, and we'd be able to determine whether or not the deformity is actually flexible or rigid. And we can come up with a treatment plan just for you. So if you're interested in this, or you have a deformity that just won't go away, visit our website at downtownpodiatryphysicians.com, or you can call us for an appointment today at 212-379-6767.